Good morning. My name is Kezia, and today I want to talk to you about something that is a little off my normal topic. I want to talk about traveling in an airport and in a hospital during the coronavirus pandemic. From what I am hearing, most of the airports are not consistent with their requirements. Some are mandating that all passengers or people in the airport wear a mask, and some are not. The screening process seemed exactly the same as it's always been. They did tell me that they're taking extra precautions by changing their mask and changing their gloves in between passengers, but I didn't see that when I was in Orlando or in O'Hara. As far as people walking around the airport, the majority of the people were wearing masks when they weren't eating or drinking. I did see some extreme cases where people were wearing paper suits, and then you saw the people that were wearing the masks with their nose hanging out. So the enforcement of wearing a mask may be there, but they're not going to tell you how to wear your mask. Also, there are some exceptions. They're giving exception to young children and people that can't wear a mask for whatever reason, so they're not scrutinizing in those cases. As far as airlines themselves, I can only speak for American Airlines, and they do have a mask requirement at this point. They were giving exceptions to small children and people that just couldn't wear a mask. They also altered their in-flight service where they were not providing a beverage or food service to reduce the risk of spreading coronavirus. So my first concern was traveling with the child that just is not going to wear a mask. So we developed a plan to cover Sienna's stroller so that she was protected and other people were protected from her. We purchased a rain cover for her stroller. Ours was actually designed for the specific stroller, but I think you can purchase a general rain cover from Amazon. Then our second point was it's probably going to get kind of hot underneath a rain cover for several hours, especially if you have to get to the airport 2 hours early. So we purchased a portable fan that was rechargeable, and we also purchased that on Amazon. As far as a mask for me, my mom was kind enough to give me a really cute cloth mask that I wore the entire time except for when I was eating or drinking. But I quickly learned that it was difficult to breathe in that cloth mask. Now, it may provide additional protection in comparison to the paper masks, but if you are feeling a bit suffocated, then you may want to switch over to that paper mask. So in addition to the mask, I decided to carry around a small container of hand sanitizer. And the airports are allowing some larger containers over the 3-ounce size for anyone wanting to carry hand sanitizer with them through the airport. You can see here how my daughter is sitting inside her little bubble of a rain cover, and she's really comfortable. She's got her little fan in here that worked for several hours. I actually have an additional battery that you can recharge and carry with you just in case it does run out. But this worked perfect for us. When we got to the hospital, not very many children were wearing masks, and a lot of them were in open strollers, and they were impressed by the use of the rain cover and also the fan. And then it's been 3 days since we've been here, and I've noticed maybe 2 other families that have come with rain covers. So I think this is a really good option, and it's not that expensive. I purchased this fan on Amazon, and it was around $20. They have all different colors and ways of attachment, but I really like this one because it clips on and it seems to be pretty sturdy. Now on the back, you can see there is no screw to keep the battery, and so with small children you just want to be aware because there is a lithium battery inside, And as far as the lithium battery, you need to make sure that the screening process is aware that you have a lithium battery. I don't think they want you to put it in your checked bag. They want it on your person. So that's something to think about as well. When we tried to enter the hospital, they were very cautious about who they were letting in the hospital. They were allowing the patient and one visitor for that patient. I'm not sure exactly how enforced that is because I saw patients with various adults with them. They were screening people with temperature gauge. For anyone over 5 years old, they would use the temperature on your forehead. Anybody under 5 years old, they would test the temperature either underneath their arm or in their ear. Additionally to the temperature requirement, they were giving the general COVID screening questions. After you passed your coronavirus screening tests, they gave you a sticker. For my daughter, we put it on her stroller because she was not going to wear it, and you needed to wear this all day long if you wanted to travel through the clinic itself. You can see here, this is the clinic we were visiting, and as you walk through the door, there were tables set up with screeners, and they would take your temperature and ask you the questions. There were also several other entrances with the same setup, and they actually had to close off some of the entrances to manage the flow of people. So here's the main entrance, and you can see they've clearly designated some of the rules if I sign. And we're about to go through the screening process. We did the exact same thing that they did the other days. They are allowing the forehead temperature for children 5 and older. So here we are in the hospital. You can see here one of the other entrances that's a little bit more busy that they drive up to. They have more screeners. This is probably the busiest area of the hospital, and in 3 days this is about as busy as it's gotten here. Now the upper levels seem to be less busy for sure, but this is the main subway level where people can come and sit and wait, maybe get something to eat, or there is some shopping. You can see that everyone is wearing a mask. There is quite a bit of change in the population. When we were here in November, this cafeteria was completely packed, and now it's under construction and not even halfway full. Now we did just pass one of the stations and they couldn't see Sienna's sticker as it's underneath the rain cover, and they did stop us. Here I wish I could show you a comparison. When we walked through this area in November, it was toe to toe. Now a lot of the retail shops have shortened hours if they're opening at all. Only a few of the restaurants are opening. It's still pretty cautious here in Minnesota. Now hopefully you can hear me, as my voice is pretty muffled through the mask, but I am in the hospital, so I want to follow the rules. The clinic environment was about the same. Now obviously we didn't hug or shake hands, but we did bump elbows to greet each other, and the doctor did wear her mask. I noticed in the clinic room itself that there were some additional signs stating that the room had been cleaned for COVID, so that gave you a feeling of security. I will say that the entire time that we've been in the hospital, I have felt safe, and I did not feel like we were being subject to coronavirus. Another interesting modification was the rules in the elevator. You can see the floor has been taped, and they want you to stay at least a square away from each other. And in the hotel, they only want one family or 1 to 2 people in the elevator at a time. Now it's pretty cold out today, so you're not seeing a whole lot of people outside, But one great thing about all of this, it has pushed people outside to actually enjoy the outdoors and sit out on the green and breathe some fresh air. I hope you enjoyed my video on traveling during the coronavirus pandemic. If you have any comments or suggestions, please leave it in the comments below. And if you want to see more videos, please subscribe to Kezia Hale on YouTube.